Ladies and gentlemen, asante sana. My DJ, can you do asante sana? Thank you so much for the lovely music. Tonight is that night for Candid Conversations. We are here in doing season 2, and this is your host, Mwangi Chege, aka they call me Mwas. We are here. We're gonna have a great time. Tonight is a Mother's Day special. There's no one who is more special than a mother, you know, and so we want to send our shout outs to all the mothers in the house, all the mothers and mothers to be who have tuned it tonight. We have a treat for you, and it's gonna be great. So tonight, ladies and gentlemen, we want to say asante sana for tuning in. This show is powered by Outburst Limited, who are the main sponsors of the event, and Outburst Limited does 3 things. They have what we call the Outburst Training Solutions for all your corporate training and team building. They also do the Outburst events, so they manage events for you, whatever type of event it is, from A to Z, you can call on them. And lastly, they have our Outburst Holidays. And Outburst Holidays is, you name it, they get you there. So ladies and gentlemen, we also want to say asante sana to all our partners and our sponsors tonight. All our sponsors, asanteni sana. This show will not be successful without you. And so I want to say thank you so much to Serena Hotels, Cakes by Violet, who gave us a cake to someone last time, Loreto Convent Musongari. You guys are stars. Kenya Hospices and Palliative Care Association, thank you for the great job you are doing in the hospices here in this country. East Africa Institute of Professional Counseling, we say thank you for the great, amazing job that you are doing with our mental health. Shako Angio Photography, wow. You know, all our posters, and I believe that you like the photos, all those are done by Shako Angio. And Namiri Sports and Fitness Apparel, who have powered us tonight. That's why I'm in a hoodie, and you can see right there, Namiri, you know, Namiri Sports and Fitness Apparel. In a short while, I'll be telling you what they have for you tonight. And then Warriors are the people who have been quenching our thirst and keeping us hydrated. We want to salute all our sponsors and all our partners. So tonight, ladies, tonight is your special night. I have some stuff for all the ladies in the house. Courtesy Namiri Sport and Apparel, right there. They have dressed me in this nice hoodie. So ladies, we have a waist strainer. When you are working out, you need to put on a waist trainer so that you get that Coca-Cola figure. We have a lovely hooded t-shirt. You know, hooded t-shirt, it's written no pain, no gain. It's yours for grabs. And then in this lovely pack, I have 2 things. I have a set of gloves, and I have some kneecaps, all right? So I have this set of gloves right there for your training purposes, and I have your knee pads. The only thing you need to do tonight is ask someone to take a video of you working out, okay? I need you to do some sit-ups. Just take the video, a short clip, 10 to 15 seconds video clip, send it to the number 0712 329 320. I will say that again, 0712 329 320, 0712 329 320. It's right there on the screen. If I were you, I'd be already working out and dress up your hubby, your kids, whoever it is. Let them take a video with you, whether it's your housemate, your children, your husband, whatever it is. We are not discriminating. The only people we are discriminating from the gifts tonight are the men. Men, I'm gonna change you, Leo. All right, all these gifts are going to the ladies. 4 lucky winners tonight to get the waist trainer, a t-shirt that has a hoodie. It's really hot. It's written no pain, no gain, gloves, and your kneecap. And the numbers, there on the screen, the number to send your short clip of video doing your sit-ups, and boom, you are getting yourself that amazing gift. Ladies and gentlemen, we want to also let you know, we want to urge you to follow us on our social media platform. Okay, kindly do that even after the show. Tell your friends, tell your relatives, tell everyone everywhere that they should follow us on our social media platform. Last week we had a blast. We had Reverend Tony Kiama here talking about lemonades and marriage, and it was such an awesome show. And tonight it will be even better. It's gonna get better. We are coming to you to handling what next. COVID-19. COVID has been one of those things that have kept us on toes for more than a year now. We don't know how long we'll be in this space, but we have to do what we need to do. So our speaker tonight, okay, did you know that our speaker tonight has received a 10/10 award in the UK in recognition of his work in HIV research as one of the top 10 who have contributed to the fight against HIV and AIDS in Africa. All right, he is a director at Kavi Institute of Clinical Research and a professor of medical microbiology and tropical medicine at University of Nairobi. He holds a medical degree, University of Nairobi, master's degree in tropical medicine from Liverpool School of Tropical Medicine, PhD, medical microbiology. Hey, Omera, University of Nairobi, teaching medicine, teaches medicine at UON and has been doing that for over 30 years. He's a professor at Stellenbosch University School of Medicine and University of Alabama in Birmingham School of Public Health. What a bio, what a bio. When I grow up, I want to be like you. He is a family man, married to Florence Simbiri Jaoko for the past 29 years. We should have invited him to talk to us last week, you know, and he has 2 daughters and he's a Christian attending church at Nairobi Chapel, Lavington, so tonight's topic, okay, is on COVID-19, and it has affected literally every sector of our lives: health sector, education sector, commerce and trade, travel, and hotel and tourism industry and hospitality. I think they are the ones who have been hit hard the most. But to shed light on this is none other tonight than Professor Walter Jaoko. Karibu sana, Prof. Wow, your names match your CV. Professor Walter Jaoko, karibu sana, my brother.
Hey, Mwangi, I wanted you to keep on going on and on and on. It didn't sound like me. You're talking about somebody else, but thank you.
That's an amazing CV. That's such an amazing CV. You know, I admire you. Nigawie kisomo kidogo tafadhali. All right. So tonight, Prof, I want us to just have a blast. I need you to enlighten us. We have been so scared about COVID-19. We locked ourselves in for the better part of, you know, last year. When we are trying to come out, we find that the government tells us to stay in, and we have been trying to observe the protocol. But before we talk too much about the vaccine, which I want to dwell in a bit, tell us where we are at in terms of COVID-19.
Okay, so thank you. So COVID-19, as you might know, we are in what we call a 3rd wave here in Kenya. So these waves vary from country to country. There are some countries that are still experiencing what you call a 2nd wave. There are some that are experiencing a 3rd wave like us. There are some which have already gone to a 4th wave. What a wave just simply means is that the numbers keep on rising, and then it reaches a peak and comes down, and you think you have controlled COVID, and lo and behold, it starts rising again and peaks and comes down. So that has happened in Kenya 3 times. So the first peak was in August last year. And then in November, there was another wave, peaked in November. And so now we are in a 3rd wave that actually has peaked, and we are doing well. It's coming down in terms of the number of new infections. What we're not doing very well in is the number of deaths.
Okay. Okay, it's amazing. It's nice to hear that. It's like a new song that we are doing well. All right, it's nice coming from you. So tell me, Prof. We have been urged to go for vaccine and for the vaccine, and this one mostly recommended for people 58 and above. And then we are hearing about our country is doing the AstraZeneca, but there are those others, you know, Sputnik 5. We have Johnson and Johnson, and the list goes on and on and on, Pfizer and so on. So if someone is listening tonight and we're wondering which is the best vaccine, what would you tell us?
Okay, I would say the best vaccine is the one that you have access to, because these vaccines are similar, and I'm going to explain why. So the idea of a COVID vaccine is that when you're given a vaccine, you do not progress from mild to severe disease. Because the problem with COVID is not really getting infected. The problem with COVID is developing severe disease when you become infected. As you know, there are many people, and even some of us know people who have had COVID and recovered. There's some who did not even know that they had COVID, and when their relatives tested positive, they were tested and they also found to be positive. So these are the people we call asymptomatic. So the problem is not being infected. The problem is progressing to severe disease. And about 85% of the people will not progress to severe disease, but about 15% will progress to severe disease, with 5% of those ones getting so severe that you can even die from it. And those are the ones who die. So the idea of a vaccine is, what can we give people so that in the event that you become infected, you be like the ones that we don't worry about, asymptomatic, or you just develop a mild disease and you recover. Common cold, running nose, loss of smell, loss of taste, and then you recover. Now, all the vaccines you've mentioned prevent you from getting severe disease. So in that sense, all the vaccines are equal. Now, when you're talking about efficacy, where you're talking about, you're seeing some, they talk about 70-something%, others 95, 93%. That measures the prevention of you getting COVID that presents with symptoms, okay? So some of the vaccines like Moderna and Pfizer will, 95% of the people will not have any symptom at all. Now, when it comes to AstraZeneca, about 76% will not present with any symptoms at all. So you look at it and say, oh, that's a bad vaccine compared with 95. That is not correct, because even the 24% who will develop symptoms compared to the 5% who will develop symptoms in another vaccine, they will not go to severe disease. And that is the aim of the vaccine. So that is why we say the best vaccine is a vaccine that has been tested and proved and registered that you have access to.
So I like that. The best vaccine is the one closest to you. And so what do we do with, I know that there has been a shortage of AstraZeneca. So what do we do? There are some people who already got the first shot and have been waiting for the second shot. Some have never gotten a shot. So for those who have gotten a shot, can they mix? For those who have not yet gotten any shot, what would you advise them?
Okay, so the idea of the shot, so every country decides who should get first of all, there's a shortage of these vaccines. You know, this is the first disease that the whole world has had to require to be given at once, okay? So there is no company that can produce, the world has about 7 billion people. There is no company that can produce 7 billion vaccines. So as a result of this, there is a huge shortage of these vaccines. And for that reason, every country has to ask themselves two questions. Who is most likely to become infected with COVID? And who is most likely to get severe disease? As I already told you, not everybody develops severe disease, but there's some people who are at risk of getting severe disease. And then each country has prioritized those groups. So even the wealthiest of the wealthy countries like the UK and the US did not just start vaccinating everybody. So they decided, some countries decided with healthcare workers because they're most likely to get infected because of the nature of their work. The security personnel, like the police, the immigration, they get into contact with so many people. So they prioritize. And it's not that they are discriminating. There is a reason why they're starting with particular groups and then progressing to the general population. Then so that is with regard to who is most likely, who has a higher chance of becoming infected. With respect to who is more likely to get severe disease, they are the elderly people. And elderly here is defined differently by different countries. So for Kenya, if you're 58 years and above, too bad, you are an elderly person. So I fall into that category. If I was living in Japan, I would be a young man because the elderly begins at 70. So each country has to decide. They have to decide who is at risk of getting the severe disease. So they started with an elderly. And so the next phase of the vaccines that come, they'll start giving to younger people who are at risk of getting severe disease. So these are people with diabetes, high blood pressure, HIV, kidney diseases, and so on. There's a category of people who will then be given. And so they progressively increase like that until they cover everybody, God willing. There are also cost implications to that. So if you notice, like in India now, they had started with the elderly people, but they have now opened it up to everybody because they have a crisis. In the US, now they have gone up to, they've started giving up to 17 years. That started with the elderly people living in homes for the elderly and so on. So I would tell anybody who is in Kenya at the moment, if your category has not been reached, continue observing the preventive measures that have been advocated right from the beginning. Your turn will come, but we need you alive by the time your turn comes.
Awesome, awesome. But for them, if they get a chance, you know, at some point we had a Sputnik available at a fee, of course, that people could purchase it. So would you advise that if people are below this age limit, but they can afford, that they should just take the jab?
Oh, yes, I would do that. So the reason why it is being rationed is, one, the non-availability of the vaccine, and secondly, the cost. The government would have to spend billions of shillings to get everybody vaccinated. So of course, if you have access to a vaccine, go for it. Now, Sputnik is a bit controversial. So why Sputnik controversial is just because by nature, the Russians have not been very readily releasing their data. So even for scientists, there'll be some scientists who still don't have enough information about Sputnik, enough information to recommend it. Why? Not because the vaccine is not good, but the way science works is that when I develop something and I test it and I see good results, not only do I announce that this vaccine is producing these results, but I make those results available to the scientific world. Anybody can look at it. Anybody can analyze, anybody can see how you designed your study, what you did, what happened. Unfortunately, the Russians have not been very forthcoming with their results. So it could be a very nice vaccine, but not many people have enough information to either recommend it or not to recommend it. It is only recently that they have also now passed the information to the World Health Organization, WHO, which can then look at it, analyze it, and if they are happy with it, can give it what you call emergency use authorization. I would be more confident if WHO gives it emergency use authorization, then I can recommend it to anybody. But for the moment, I cannot recommend it, but I can also not recommend it not to be given. It's just that I don't have enough information.
Awesome, awesome. Now, Doc, Professor Jauko, there is just the other day, you know, India was hit hard by the COVID-19 mutation. Our country, people have been very worried because it was alleged that it was in Uganda, and then it had already come to the lakeside where you come from, and we don't know. Could you kindly shed light on these mutations and what we need to do?
Okay, thank you. Just before I got into that question, I realized I didn't finish part of the other question, the issue of mixing and matching. So you can't mix and match vaccines. So once you've been given AstraZeneca, you can't get another one Because if you get another one, you'll be starting afresh. The way the vaccines are made, they work differently. And so you cannot mix and match. I always compare that to antibiotic, for example. So if you're given augmentin, you don't take augmentin in the morning and in the evening you say, I'm going to take tetracycline, you know, because they work differently. So it's the same thing with the vaccine. So until we test the mixing and matching, we cannot be able to say that you can start with AstraZeneca and get a second dose from another vaccine. Now, regarding what is happening now with the Indian mutant, so what happens is that viruses, this particular group of viruses, they're called RNA viruses. When they are multiplying, they make mistakes. Because essentially what viruses do, unlike what other animals do, where they reproduce, where there is mating and then production of offsprings, for the virus, what they do, they make copies of themselves. So a virus just makes another copy, and then those ones make other copies. So they just keep on copying. The problem with their copying is that they're not accurate. So they can make a mistake. Now the mistake, when they make a mistake, if it's a minor mistake, that's not a problem. But if they make many mistakes in the copies, so what is produced now is different from the original. And that is what is called a mutant. So, and then when you have several mutations, it constitutes a variant. Now, there are so many mistakes these viruses make, we don't worry about that. The problem is when they make a mistake that makes the new copies of that virus either more lethal in the sense that if you become infected, you have a higher chance of dying, or makes it much easily transmitted, unlike the original copies, or when it escapes detection. So that makes a problem with diagnosis. Now for COVID-19 virus, when that happens, they're called variants of interest. Variants of interest. Now to date, we only have 4 variants of interest. The ones that we're worrying whether that has happened, whether they've become much easily transmitted or causing more severe disease, or they might have escaping mechanism for detection. And so the 4 are the South African variant, the UK variant, the Brazilian variant, and now the Indian variant. But with regards to number of variants, there are more than 60, 70 variants at the moment, but we don't worry about them. In fact, sometimes the virus mutates to its disadvantage. It can mutate to become even less lethal or less easily transmitted. So we don't worry per se about mutants and variants. We worry as to what have they resulted into. Now the Indian one seems to be more lethal, just from the observation that we're seeing, and every country is making every measure to prevent it from coming. My concern for the variant, the Indian variant that has come to Kenya, my concern is that our systems have not worked. They have failed us somewhere. Because the way you want to prevent a virus causing COVID, there is no distinction between original virus and a mutant virus. So if our measures were in place to prevent us from getting COVID coming into the country, it doesn't matter whether it's a mutant, whether it's a new variant or not. Our system failed us somewhere, because as a country, we say that before you come into this country, you must have tested COVID negative, and that test must have been for less than 36 hours or 72 hours. So the question you ask yourself, how did it happen that people who are already infected in that numbers come, not only land in Nairobi, but even go as far as Kisumu? So that is my concern. Now for prevention, we just need to continue with the measures that we need for ourselves. Wash our hands, sanitize, social distance, keep on wearing masks. It will prevent you from any virus, even the mutant viruses.
Awesome, awesome. Professor, I want you to take a break, enjoy a cup of water, and then we come back. And when we come back, we'll be looking at what next. What does the future hold for us? But I want to just remind us that here at Candid Conversations, we enlighten mind, inspire people, and enrich lives. We do this as a CSR, and ours is to make sure that we support the palliative and hospice care here in our country, Kenya. And so, ladies and gentlemen, I want to give you an opportunity to give towards the cause, and the number is right there. The till number is 750-822. And this is the number to give if you want to be a blessing to the hospices and palliative care here in Kenya. The number is 750-822. We have been supporting the Gio Hospice for the past 4 years, and we believe that going ahead, we should not only support this the Gio only, but we want to go and try and support as many hospices in this country as much as possible. So kindly, ladies and gentlemen, to keep us going, kindly support us. The till number is 758-22. I also want to acknowledge all our sponsors tonight, all our sponsors. Thank you, and partners. We want to say thank you. You guys are amazing. Without you, we'd not be here tonight. Outburst Limited, you're saying make it count. Thank you for making it count. Serena hotels in Kenya, Tanzania, Zanzibar, Uganda, Mozambique, and even Rwanda. What a hotel. We want to stay in all of your hotels. Cakes by Violet, Asante Sana, Loreto Convent, Msongari, you are stars. Kenya Hospices and Palliative Care Association, continue doing the good, amazing job. East Africa Institute of Professional Counseling, we are talking mental health, and you have been very supportive to us. Shako Angio Photography, I'm liking the photos on the posters. You are awesome. Warriors, thank you for hydrating us. Asante Sana, keep the good job. And tonight, this ladies edition, Mother's Day special, has been powered by Namiri Sports and Apparel, and that's why I am wearing one of what they offer, Namiri Sport and Fitness Apparel, and we have decided that we need 4 ladies to take away a gift tonight. And ladies, what you need to do is take a short video of you doing sit-ups, okay? Just a 10 seconds to 15-second clip. Send it to the number 0712 329 320 0712 329 320. That's the number to send. And the things for you to take away include gloves, gym gloves, yours for the taking, kneecaps when you're training. We have t-shirt, it's written no pain, no gain. It's amazing. I have one in black. And lastly, and this one is the best, this one is for the winning lady tonight, the waist strainer, okay, to give you that Coca-Cola shaped bottle. Because here at Candid Conversation, we are talking health and wellness. And this season, we are tackling mental health. And COVID-19 is one of those things that have really affected our mental health, Professor Jaoko. It has messed us up, you know, us being locked in for long, tujazoea hiyo maneno, people have lost jobs, and families have been fighting and things like that. Professor Jaoko, what advice would you have for us in this season in regards to just mental health from your perspective?
Okay, thanks, Mangi. I can only speak about mental health from a general medical perspective, not as a psychiatrist. But the thing about mental health is more often than not, people who fall victim of mental health are people who have no social networks. So people who keep things to themselves without sharing. I'm glad that you have a group like this where people hopefully have friends where they can call in the event that there is something that they need to discuss with somebody else. I would strongly recommend as well, studies have shown actually that people who make reference to a higher being have a much healthier mental health. So if there is anyone here who does not recognize the presence of a higher being, like God, for a Christian, and those studies actually have indicated it's not necessarily a Christian God, but any anybody who makes reference beyond themselves. So I'd encourage you to make reference to God. And if you can, make reference to the Christian God if that is your background, and you can be able to do that. So networks, a spiritual sense, helps us to sober up. Actually, COVID has reminded us once again that we are not perfect as human beings. When COVID has come and dismantled everything, so it can make us to reflect and know that this world is not only just for us, really, that there are forces beyond us. So making that spiritual connection is a very, very useful thing. So I think those are the key ones. There are many other things that you can do. You can listen to music, you can take a walk, you can exercise. The way you are encouraging the ladies to exercise, let that be a routine, not just to get the t-shirt.
Yes.
But to make it a routine, because exercise produces some things we call endorphins that help you relax. You get melatonin that also helps you to sleep well. So exercise is also something that you can also recommend. And then healthy diet, man, don't just eat chips every day, and soda. Try and eat some vegetables. It doesn't have to be something that is expensive, but sukuma wiki, a bit of beans, and mix that. So health is a very key thing to also, physical health is a key thing to mental health as well. Over? I think our host is frozen. Or is it me?
It's the host.
Okay.
We can.
Okay. Sorry, Mwangi, I'd finished.
All right. Sorry, everyone. We are getting used to this new norm where we are on a network and then you're thrown out and back in. So we're getting used to it. Thank you, Prof. I want to also acknowledge people who are watching us on Facebook Live. Last week they told me that they felt discriminated. So tonight I want to send my shout outs to Gonya Busaka, who is watching on Facebook Live. We have Faith Diongo watching on Facebook Live. It will be nice to tell us where you're watching us from. And I want to also give an opportunity to you who is here on Zoom to ask your question, to send your shout outs, and also let us know where you're watching us from. Lillian Award Onyango is also watching us from Facebook Live. I want to say asante sana. You guys are stars. Just by being here, you are encouraging us big time. So thank you so much. We are getting into our part B of this session tonight, our episode tonight, and I need you to start sending questions so that they can be answered by Professor Jaoko. Any questions that you have in this area of COVID-19 and vaccines, kindly do that. I want to say a big hi to Anne watching from Eastlands Uhuru. Yeah, some of us grew that part of this country. It's amazing. Nancy Okita, I can see you. I can see your question. We'll be asking your questions in a short while. Tonight, I need you to ask your questions. Let's throw some shout outs, and then to also wish our mothers a special Mother's Day. I know it was on Sunday, but we want to celebrate it the whole week. So Prof, before I get into the question and answer session, which we'll be doing that in a short while, I want to ask, the schools have just opened. The schools have just reopened, Prof. Are our children safe, or how safe are our children?
Thank you. That's a $1 million question. It's a question that many countries grapple with. If COVID was only a medical problem, schools would not open up. But the problem with COVID that it bites across all the sectors, so education, health, economy, industry, travels, and so on. So it's a balance that each government has to make. Now, to answer your question, of course, there is an increased risk when your children go to school, but the risk per se is not to the children, the risk is to you. Just during the third wave, when the third wave was starting and the schools were still open, their parents who became infected by their children. So children come back from school, they have COVID, but their bodies have a strong immunity. They just have a cough, a running nose. You even take them to a local dispensary, they're given medicine and they recover. And you assume, yes, it is just a common cold. I can tell you stories of people who have that happened to, and another child also gets a running nose, and you think, oh, it's one child has passed it on to the other one. And then until parents get it, and yours is not going away, like the children whose bodies are fighting it very easily. And some then, you know, that is when you do a test and you realize, the cold that the child came with was not really common cold, but it was COVID. So what should we do? It's just to encourage. It is difficult, especially for the younger children, to just encourage them to, you know, to wear masks and to keep social distancing and all that. And I'm saying that fully aware that the younger children is much more difficult. But the older ones, you can explain to them. I have a friend who got infected from a teenage child who didn't care, went partying and all this, and she kept on telling him not to, but she didn't care until she got COVID. He was asymptomatic, and when he was tested, he also tested positive. So that's when we knew that it was him who brought it home. So the short answer to the long question is that we just need to continue being vigilant with the preventive measures that we have, but schools have to open one way or another. We can't keep the schools closed for 2 to 3 years if COVID is going to go for that long. So it's a fine balance that governments have to make.
Awesome, awesome. Okay, so Nancy Okita is asking, what is this myth that the vaccine will make one get clots?
Okay, so it's not really a myth. So what happened is when the vaccine was initially given, particularly the AstraZeneca vaccine, there are a few cases of clots that were identified. We didn't know whether it was associated with the vaccine or not. And so investigations have shown that some, not all, there is a possibility of some people getting clots. So it's no longer a myth, but it is that risk that is so small that it does not prevent us from using the vaccine. So let me give you an example. Many women take oral contraceptive pills, the family planning pills. Family planning pills have a risk of giving you clot, a much higher risk of giving you clot than a COVID vaccine. But we have not stopped using contraceptives. All that we do is we guide people, we assess you and say whether you should use an oral contraceptive pill or not. So to give you an example, the AstraZeneca vaccine, if you get a vaccine, 4 cases in 1 million people have a risk of getting a clot. If you take contraceptives, 1,200 women are at risk of getting a clot out of 1 million people. So compare 4 from the vaccine and 1,200 from taking an oral contraceptive pill. And if you get COVID itself, COVID, about 165,000 people out of 1 million people get clots. So the question we always ask ourselves for vaccine is, what is the risk and what is the benefit? So we do what is called a risk-benefit analysis.
Okay, so the risks, you know, it's better, what you're saying, it's better to take that risk because it's much lower taking the shot than not taking the shot.
Yes, yes.
I like that. Okay, someone is asking, are we certain we will get our second shot on the new revised dates? I think the worry, they probably have already gotten the first shot. They're wondering, will we ever get the second one? AstraZeneca Manenos.
Thank you. I wish I could answer that question. That is a government question. I'm really hopeful. So let me explain a little bit and why I'm not worried myself. I've actually missed my second shot. I was supposed to get it on 30th of April. I was among the first 100 people to be vaccinated when the government started. So we were all due to get it on 30th of April, but unfortunately the vaccines are not arrived. So we have a new date. Mine is 28th of May. So in effect, that will be 12 weeks from the time I got my first dose. Now, the way the manufacturers made the vaccine, they recommended that you get it 4 weeks after getting the first dose. The first dose is called a prime, the second dose is called a boost, but it's the same vaccine. Now, what happened is the UK made a pragmatic decision to delay the second dose because they argued, what is the point of having a few people fully vaccinated and there are many people who are not vaccinated? So they said, why don't we give the first dose to as many people as possible and delay the second dose? So they delayed the second dose, to 8 weeks and some people to 12 weeks. What is interesting is that the delay was actually better than the 4 weeks. So the people who got the vaccine 8 weeks later had better responses than the people who got it 4 weeks later. And the people who got it 12 weeks later had better response than the people who got it 4 weeks and 8 weeks later. So I'm not worried. When mine comes, it will be 12 weeks. So
Awesome.
I know that it will be a good response. The question we have to ask ourselves then, what if it delays further than the 12 weeks? Now, the government has promised that it will not delay beyond the 12 weeks. But in the event that it does, now we don't have data of whether it is good or equal or worse. So we will be the ones doing that experiment now. The UK did not delay it more than 12 weeks.
Pole sana, Prof, you know, you are among the people being called old. You are among the ones who are doing the test for us. Don't worry, God is with you. All right. Someone is asking, with lions testing positive for COVID-19 in India, what does that mean for humanity in your view?
Well, I'm not worried. We don't get into contacts with the lions that much. We know that COVID actually starts from animals. So all the coronaviruses, and this is the third coronavirus that has infected human beings. The first one was called SARS-CoV, that started again in China, affected a few countries. The world controlled it before it became a pandemic. The second one, and that one came from some animal called the palm bear. Then we had Middle East respiratory coronavirus, which took place in about 2017, thereabout. Started from camels. So the camels infected human beings and it spread to a few countries and we controlled it. This third one has come from an animal called a pangolin. So we know that animals are infected. So if we find a lion infected, that is not news. The question is, if we start having domestic animals infected, then that is where I'll be concerned. So if you hear chicken and donkeys and infected, I'll start becoming concerned. Now, let me just tell you something interesting that maybe many people do not know, that our camels in Northeastern, they have the Middle East respiratory coronavirus. And I have a PhD student who has shown that, tested them and found them to be infected. But what is interesting is that the people there have not been infected with the virus. So the fact that you even have it in animals, it does not necessarily mean that it will infect human beings.
Oh, amazing. So there's, at the moment, there's nothing to worry about. And I like that part where, you know, we don't come into contact with lions, especially in our country. We see them from a distance. Jane Matu, you did not tell me where you're watching us from, but thank you for tuning in. And Jane is asking, is it safe to take the vaccine if you are one, if one has been treated for severe cold or illness in the recent past?
Yeah, there is no problem. If you have been treated, if you have been severely ill and you've recovered from the illness, there's no problem. Actually, this vaccine is even safe for people who are currently chronically ill. We're giving it to people with kidney failure, we're giving it to people with high blood pressure, diabetes, asthma. So the vaccine was tested in those group of people and it was found to be safe. I think the question that she's alluding to when she talks about a severe cold, she's wondering what if she did not test and maybe it was COVID. The good news is that even if you have been infected by COVID and you recover, you can get the vaccine. Now, the interval between when to get it after recovery is what varies. The US Center for Disease Control recommends 2 weeks. The European bodies recommend 4 weeks. The Kenya government recommends 6 months. I think the Kenyan government is probably exaggerated, just in the sense that they would want to give people a chance. People who have not been infected with COVID have a higher risk of getting infected compared to people who have been infected and recovered because of what we call partial immunity. So I think that is why they gave the 6 months. There is no scientific basis for that. So yes, if after, I tell people after 4 weeks, if you've recovered and you even tested COVID positive and you know it, after 4 weeks, you can get a vaccine. I have relatives who did that and they got vaccines, even my own household.
So Evanson is asking, is it safe to get vaccinated without getting tested? What if you're vaccinated while you're positive?
Actually, there is no problem. The whole world, there is no country that is testing people before you get a COVID vaccine, because you can even imagine the feasibility of doing that. If we don't even have enough kits to test people who have symptoms of COVID, then now you want to test everybody before giving them a vaccine, it will not be logistically possible. The beauty is that no world is doing it and people are being vaccinated. Among the people being vaccinated, there are some who actually are incubating COVID. They have COVID, but that is why you hear some people after getting 1 dose, 1 week later, you hear they have tested positive for COVID. We have seen it in this country, and it's usually the politicians who announce, but there are more than that who just experience it quietly. So the first dose will not protect you to a level of getting 2 doses. But if you're incubating COVID and you get a vaccine, there is no problem. You'll just develop the COVID and we treat you the normal way we treat everybody else.
Okay. So I have Ihaji. Ihaji is from Mariakani. All right. Ihaji, uhaligani lakini. Nice to see you from Mariakani. And he has a question. They have a question that they're asking. I deal with KP program and my clinicians got the vaccine. Do they still need to wear the protective COVID gear when seeing patients?
Oh, yes, they do. Yes, they do. So vaccines work in different levels. So there are different vaccines that their focus is preventing you from becoming infected. As we rightly said at the beginning, if you joined late, I'll repeat, the benefit of the COVID vaccines is prevention of from mild to severe disease. Then there are some vaccines that then protect you from transmitting infection to other people. So for COVID, we're still not sure whether that vaccine prevents transmission. So that will come later. Our focus at the moment is severe disease. So you can imagine if I'm vaccinated and then I can still become infected, but I'm now asymptomatic. I don't have any symptoms. And so for me now getting into contact with people and saying, because I've been vaccinated, so now I don't need to wear a mask, I would still be infected and be transmitting the infection to other people. So the short answer is that keep on wearing masks, keep on social distancing. The hope is that once a certain percentage of people globally or nationally have been vaccinated, then the COVID virus will not find a place to inhabit, and so the disease will go away. And that is why we talk about herd immunity. And we have no time to go through that. Herd immunity just means that even the people who have not been vaccinated, if you have sufficient number of people around you who are vaccinated, then you become protected. And that takes time. So it's not at the beginning of vaccination. So keep on wearing your mask, social distancing, sanitizing, washing hands.
Prof, there's a young man who is your friend. He's called Omonge. I believe you know him. And Omonge is asking, some people have been vaccinated, got sick and died of COVID-19 related symptoms. How do you explain that?
Okay, thanks. I know so many Omonges. I don't know which particular Omonge this
one
is. But
Donald.
Donald is the younger boy. So yeah, so this has also been social media circulated and so on. I would say that I have no answer because I don't know the details of what has been circulated. I have seen some stories about an American doctor who went to India having been vaccinated with the Pfizer vaccine and went and got infected and died in India. So people have said, oh, probably one theory, and here we are just speculating. One, probably the Indian mutant is not the vaccine. The Pfizer vaccine does not work against the Indian mutant. But then I've seen a colleague of the same doctor in the US saying that actually what killed him was not COVID, but he died of heart attack. So the problem with social media is that I can get a story and spread it without even knowing the details, and it can give false alarm, false information. So in the short of it, Donald, is I have not enough information I've not come across anybody who has been fully vaccinated and have developed COVID-19, became serious and died. So I will not be able to answer the question, unfortunately.
All right, amazing, Prof. We are international. Peter from Cape Town is saying, hi, Peter. Peter is asking, is there any known allergy that will prevent one from taking the vaccine?
Okay, so the allergy that we worry about when it comes to vaccination, and it's not just COVID vaccine, it is something we call anaphylactic reaction, a very long word for a condition that when your body gets into contact with something that it doesn't like, you react in a very aggressive manner. So these are the people who the limbs swell, they have difficulties in breathing, and they can collapse as a result of anything, not just a COVID vaccine, any injection. That is why before being injected in a hospital, they ask you if you have any allergies that you are aware of, just to try and rule out anaphylaxis. Now, what happens with the COVID vaccine now is because we are giving it to the population, the guideline is that if we give you the vaccine, we should observe you for 15 to 30 minutes, okay? Because anaphylactic will occur immediately you are given the vaccine. Now, all the health facilities where the COVID vaccine is being given have resuscitation kits. There is something that we can give you. There's some medicine that we can give you immediately you get anaphylaxis so that we reverse that process. So at the moment, you should not fear getting a vaccine. Go and get a vaccine. If you have a history of anaphylaxis, and those people know themselves, there are not many, they'll tell you, I have reacted like this before. There are people, even when they're stung by a bee, they can die because their mouth swells, their breathing is affected. So that is what we call anaphylactic reaction. Now you are getting this vaccine in a health facility where that can be addressed. So don't fear, go and get your vaccine.
Awesome stuff. I have been quiet more than, it's unlike me, Prof. I keep talking and talking in this show, but tonight I've been quiet because I love to learn. And so tonight I've learned a lot. But before you go away, Prof, I will be asking you to do your parting shot, but in a short while. Amazingly, tonight was a Mother's Day special, and we want to give our ladies some gift items. I have 4 giveaways. Now, we have not received videos from the ladies. So this is what I want to ask. I want men to bite the bullet for them. The men to take a bullet take a bullet for your sister, for your wife, for your girlfriend, whatever it is, for your mother. Bite the bullet for them. Take a bullet for them, like you promised that you can cross the ocean for them. Let me see you doing some workout, whether it's sit-ups, push-ups, jumping jacks, whatever it is. We have only 5 minutes to go. Send your clip, men. Send your clip and say who you're dedicating the clip to, and we will send you the gift so that you can gift them, all right? I will repeat, men, you are the ones, biting the bullet for your loved ones, your mother, your wife, your sister, whoever it is that you'd want to gift. Do some workout for them. Do some 10 press-ups or 10 sit-ups or 10 jumping jacks. They should be taking a video, or whoever is near you, send the video to us, and we will send the gift to you. I have a waist trainer, courtesy Namiri, a waist trainer for their figure 8 right there. We have the hoodie, no pain, no gain, all right? It's white just like the way the ladies like them. I have a knee cap for them, and then we have the training gloves for the person that you would want to do this for. So men, let's bite the bullet for our loved ones, all right? Let's bite the bullet for the women in our lives, whether it's your mother, your sister, your wife, your girlfriend, whoever it is. I'm giving you only 5 minutes, and then we will, and you need to write who you're dedicating this to, and we will be sending this to you so that you can be a blessing to them. Ladies and gentlemen, before we wind up, I want to let you know that here at Candid Conversations, we do this as a CSR powered by Outburst Limited, and it's our CSR arm. So kindly feel free to be a blessing and to the hospices in Kenya through supporting Candid Conversations. The till number is 75822. If you are loving the show, if this has been helpful to you, but also that in this season that has been difficult, we want to be a blessing to someone. We want to stand with those who are hurting. And so the numbers to send is 75822. Send your 1,000, your 500, your 50 bob, your 10 bob, whatever it is, it goes a long way. I want to read a few of some shout outs here. Let me see. Jane Matu from Thika, you're saying very informative session, loving the show. Asante sana. Geshoke asked a question. Can one kiss a former COVID victim? And we are not calling them victims, you guys. All right, no stigmatization. But I think Debbie has answered the gentleman in saying yes. Once they have recovered, there's no harm. All right. So probably some people who are helping us in our job of creating awareness. All right. So Debbie has come out there strong. And that's what we're doing, guys, that we learn and then we pass information to the people, whether on this platform or those not in this platform. The most important is to share information to keep people enlightened and to be in this together and work as a team. Judy is saying very informative session. Thank you, Team Outburst. Debbie again is saying thank you for the information, informative session. Debbie is watching us from Kisumu City. Kisumu Dala, wapatie salamu zetu. And then, ladies and gentlemen, kindly follow us on our social media platform on Facebook, Instagram, Twitter, IG, and YouTube. Actually, you can get all our recordings of this show and the past shows and the future on our YouTube channel, Outburst Limited. So if someone asks you, just tell them to go there and they can do that. Omonge is saying, thank you, Prof. and Outburst from Seme. Seme imewakiliswa. Nancy is saying, very informative. Can we get a recording? Nancy, tomorrow, go to our YouTube channel, Outburst Limited, and you will get this recording there. Julie is saying, number to send the video again. Number to send the video again. All right, the number to send your video working out. Let me see. The number is 0712 329 320. 0712 329 320 329 320. I will ask that the number be left there for at least 30 seconds or so that the men who are biting a bullet for the ones they love can actually send, and we want to award you before the end of the show. Thank you so much to all our sponsors at Serena Hotels, Warriors, Namiri Sport and Apparel, Namiri Fitness and Sport Apparel. Thank you for the amazing gifts tonight. Shako Angio for your photos, and all our partners. We want to say asante sana, all our sponsors, Cakes by Violet, East Africa Institute of Professional Counseling, Kefka, Loreto Msongari, asanteni sana. You guys are amazing. You are stars. And for you who is watching us tonight, thank you so much for being part of Candid Conversations. You can actually also come on board as a sponsor or as a partner or where you work or in your company. The doors are still open. And as we wind up the show, I want to ask Professor Walter Jaoko. I keep saying doctor because I have known you many years, you know, and so sometimes it's hard to switch. But Professor Walter Jaoko, kindly, what does the future look like? Give us your parting shot.
Yeah, thank you. I think the future depends on us as a human race as to whether we will work concertedly to control COVID-19. But I would want to say people should not live in fear. We should do what it takes to prevent ourselves from becoming infected as much as we can. As I'd mentioned earlier, I personally, as a Christian, I draw my strength from a belief in God, and the Bible tells me in a book of Proverbs 22:3, saying that the prudent see danger and they take refuge, but the simple keep on going and pay the penalty. So if you take COVID-19 lightly and you do not take precautions, then unfortunately you will not be wise. So if you have access to a vaccine, please get a vaccine, continue the social distancing, the masking, and so on. But then we should not live in fear. Fear has a way of keeping us, preventing us from releasing our energy and living our purpose in life. So we should not fear, but we should take precaution. That is what I can say this evening. Thank you.
All right, Professor Jaoko, someone is asking at the Proverbs what again?
22:3. Proverbs 22:3 says that.
Proverbs 22:3. All right. Proverbs 22:3 right there. Ladies and gentlemen, this has been your most amazing show every week, Tuesday from 8 to 9. Asante sana, Professor Jaoko. We are so grateful. We will put your contacts there in case someone would want to reach out to you or your organization. We'll put the contacts there. Once again, we want to say thank you for taking time to come as a guest here at Candid Conversations. We don't take it lightly. We want to say asante. You can also reach us. Our contacts are right there, Outburst, info@outburst.co.ke, and our numbers are right there. And like I keep saying, this is what we do: enlighten minds, inspire people, and enrich lives. We want to give you these gifts, all right? I want to give the gifts. I want to ask Professor Jaoko, is there any one in particular, as you have been, you know, our guest, is there anyone in particular that you're thinking, maybe I should give that one? Maybe there were a lady who was participating more, even if they didn't send the clip before I watched the clips. Anyone, Professor?
Anyone I can recommend a gift for?
Yes.
I would recommend for, I don't know her, so I'm declaring no conflict of interest. Jane Matu.
Jane Matu from Thika, you've been recommended by our guest. And so, Jane Matu, we are sending you the knee caps, all right? The knee cap, the knee pad, so that when you're working out, kindly send us your number. I know you're in Thika, it will come right where you are. Asante sana, Prof. And then we have some other winners tonight. We have some winners tonight. There's a gentleman who I am seeing did quite some workout tonight. Okay, and this I don't know his name, but he has dedicated the gift to Beth. Okay, to Beth. I will ask my team to tell me who this gentleman is. He's been doing a workout there, and he's dedicated the workout to the wife Beth. And so to your wife Beth, I give them the No Pain No Gain t-shirt. No Pain No Gain t-shirt is yours for receiving. Beth, I need your husband to get in touch with us, or your boyfriend. Oh, it's Paul Kagai. Paul, your wife will get the No Pain No Gain t-shirt. All right, and then we have another person dedicating to Valentine Wairimo Bogwa. Okay, someone has done some workouts right there. Okay, and this is Valentine Wairimo Bogwa. I give you a pair of gloves, Valentine, with Namiri right there. Okay, so that one is yours for the taking. And our winner prize, which is to give you that figure 8, goes to none other than a gentleman called Dalmas Were, who sent his clip doing many push-ups as early as we said, and this one is dedicated to your wife, Dalmas Were. We will be giving you this lovely gift. For all of you for participating, we send you our love and kisses right here from Candid Conversation. This has been your host, your one and only Mwangi Chege, aka MC Moas. Thank you so much, Professor Jaoko. Until next week, you need to tune in, because next week we might just be bringing Reverend Tony Kiama back, because due to public demand, we might be doing a lemonade and marriage part 2. It was out in public demand. Faith Kihara, you're saying congratulations to the winner. And Deuri, you're saying great session. Paul, you're saying thank you. Omonge, I dedicate to my wife. Omonge has dedicated kisses to his wife. Awesome. Let's keep supporting one another, especially in this season. Like I always say, in it together, we have to get out together, because we cannot do it without teamwork. Let's support the people at home. Let's support the people we work with. Let's support even as strangers. Until we meet again next week, same time, same station. Actually, have you noticed the Zoom details do not change? So you can use it again next week at same time. Until we meet again, it's bye-bye and good night and God bless. Cheers, bye. DJ Kanye.